as well. And we want to make sure that everyone across our region has and maintains their healthcare and access to the services that they need when they need them. And that's what today is about: is how do we really focus on retention during this time. For today's agenda, you're going to learn about how, as nonprofits, you can leverage your role as trusted messengers, or whatever organization you're with, as trusted messengers to keep our community members healthy. You'll learn about Medi-Cal changes that have and will take place, learn more about resources available to support you in your retention efforts, including resources from IEHP, San Bernardino County, IEHP Foundation, and the Benefits Cal platform as well. We also have some vendors and friends in the back there, so make sure to go say hello and talk with them before you go. You'll have access to all the materials. We'll receive an email with a link to the resources mentioned, along with a recording of the presentation as well. So, Sarah, will they get a copy of the slide deck? Yes. Okay. I'm always wondering that. Do I need to take pictures? Do I need to take notes? So we will send that to you. You don't have to. So with that, I'd like to introduce to you our two board members, Gerard Tamperong and also Karen Scott, two outstanding board members. We have a terrific board of the foundation. Would you come up? Thank you for joining us. And I'm going to hand it over to Gerard first.
Thanks, Greg. My name is Gerard Tamperong. I'm on the foundation board. I work with a firm called Composition Wealth. But when Greg was talking up here, he talked about upstream drivers to promote health. And I think that is exactly key to why you're all here today. Thank you for being here. When I walked into this room, I was overwhelmed by how many of you were here. So thank you for being here. As you know, the foundation's here to support you. All of our nonprofit partners want to help build capacity, advocate for better health policies, and stay informed on the changing Medi-Cal landscape. And that's clearly a lot of things. I was speaking with Andrea earlier. She's got a lot in her plate, so I hope you really pay attention to all that. So today we have over 100 of you leaders in this room. Please use it as an opportunity to network with each other, ask the questions that you need to ask, and please continue to use the foundation as one of your partners. And my friend Karen Scott.
Thank you, Gerard. So I am excited to join Jared, and as as the IEHP Foundation Chair and as Executive Director of First Five San Bernardino, I cannot emphasize enough the critical role partnership across all sectors will play in ensuring our Inland Empire families stay healthy, especially in the years to come. Thank you for showing up today and for showing up every day for our community. Speaking of partnership, we are so grateful for our partnership with IEHP. Because of that partnership, we have access to this beautiful space, as Greg mentioned, and to the information about changes to Medi-Cal that you will hear about later today. I'm excited to share that we are joined today by IEHP's Board Chair, Kurt Hagman. Supervisor Hagman? Supervisor Hackman was elected to serve San Bernardino County's 4th District in 2014 and was named Chairman of the Board of Supervisors in January 2019 and 2021. The 4th District covers Chino Hills, Montclair, Ontario, and the southern portion of Upland. In addition to his duties as supervisor, Hagman serves on multiple boards, committees, and commissions, including as chair of Inland Empire Health Plan, among many others. Supervisor Hagman holds a Bachelor of Arts degree in psychology from UCLA. He and his wife, Rosanna, and his family currently live in the Chino Valley. He is also proud to serve as a Lieutenant Colonel, Civil Military Operations Officer for the 40th Infantry Support Detachment in the California State Guard. Thank you, Supervisor.
Well, good morning, everybody. It's a pleasure to be here, an honor. And I am also very impressed by how many organizations we have here today. And want to thank you, first of all, for doing this, and thank our wonderful partnership with the Inland Empire Healthcare Foundation, who's doing a fantastic job. When we talked about this a few years ago, it's how do we make the link from the mothership to the community? And you guys are doing a fantastic job, and thank you for putting this on. Thank you, Greg, for all the work that you're doing. And we are all stronger together. Healthcare access to our community is a team sport. You can't do this by organizational level. As much as I love the county and IEHP, we need your partnerships to reach out. You are that first line of introduction to what benefits out there. As an elected official, when I talk to my residents, half the time they don't know what's available to them. So it's very important that you are that communication, you are that lines, and to have events like this where you can learn what changes, because we know there's a lot of changes coming, and to stay informed, to stay aligned, to be one mission for our residents who we're here to do is so important. So I thank you for your time that you're putting into this. Thank you for the IHP Foundation for all the hard work they're doing to communicate and to build up the infrastructure. We're stronger, the stronger you are. The stronger the organizations are, the better our residents can get their services that they're entitled to, that they need to become healthier and to be more vibrant parts of our community as well. So thank you all for being here. And yeah, this is a great facility that we have here that please use anytime. You're welcome to come to our board meetings downstairs that we have as well. But every time there's challenges and changes in the direction of that we go, the more information we get to work together is better off. So again, thank you and welcome to the event today.
Good. Thank you. I think we're going to do a photo. Are we doing a photo?
Awesome. Yeah, let's get a photo. And while we're there doing that photo, again, just want to say thank you all for showing up. For those of you I haven't had a chance to meet before, my name is Sarah Omari, and I'm the Grants and Strategy Manager with IEHP Foundation. Thank you. Can we give them another round of applause? Thank you. And as you can see, it is a team sport, and we have what I would say is our coaches and leaders in the room with us. So it is everyone hands on deck as we're here supporting our community. So I'm here to introduce our next presenter. I'm really, really excited to bring Andrea here. This is why everyone showed up today, to learn about the Medi-Cal changes, learn about the opportunities as community-based organization leaders, how you can leverage your role as a trusted messenger to support your community. So please join me in welcoming Andrea Campbell. So she has a very impressive bio, so bear with me. So Andrea Campbell is a lifelong resident of the Inland Empire, raised in Riverside, California. Any folks from Riverside in the room? Ooh. For more than 20 years, she has dedicated her career to public service. Andrea began her journey with the County of Riverside, Department of Public Social Services. Since June of 2022, Andrea has served as the manager of the Eligibility and Outreach team at IEHP. She oversees a team of 60 professionals dedicated to member retention and community engagement. And if you get a chance to check out the table in the back, you can learn more about what her team does and how they can support you. And then Andrea holds a Bachelor of Arts in Public Administration from Cal State University, Chico, a Master of Science in Leadership and Management from the University of Laverne, and a Master of Education in Adult Education and Development from Strayer University. So please join me in welcoming Andrea Campbell.
Thank you, Sarah. Good morning, everybody. I'm so glad that you made your way to our campus today. It's a beautiful Tuesday here in Rancho. Before I get started, I would be remiss if I didn't recognize my team back here, Gary Fletcher and Justin Martinez. So if you have any questions at the end as it relates to what I'll be presenting on, please feel free to ask them. They also have some swag, but you don't have to just go to get the swag, okay? So today I'm going to be talking to you guys about some upcoming Medi-Cal changes as they relate to Californians without satisfactory immigration status. So have you guys heard of HR 1? The big, beautiful bill? So that's what we're going to be talking about today. We, in our organization here, we just refer to it as unsatisfactory immigration status, all right? So we are going to be providing this presentation to you, as Sarah said, but it's on multiple screens all around you, so if you can't see it very well. But I just wanted to start off by giving you guys a timeline of some of the changes that have happened in the past and then what we'll see going forward. So as of June 30th last year, the public health emergency flexibilities ended. So some of those flexibilities where individuals didn't have to turn in their renewal packet, where certain waivers didn't apply for income, for property, things like that. All of that ended June 30th of last year. So what we saw take place starting January 1st of this year is that the asset checks for seniors and people with disabilities, that changed. So the asset limit is now $130,000 for one person, and then you would add $65,000 for every person with a max of 10 persons. So this is really critical because when you think of assets as resources and dollars that you have in your checking account, savings account. So that's one of the things that changed January 1st. Also, one of the most critical thing that changed was the UIS, so unsatisfactory immigration status enrollment freeze. So what this says is that some adults will no longer be eligible to sign up for full coverage Medi-Cal based on their immigration status, which really hurts a lot of the population that lives here in our Inland Empire communities, Riverside and San Bernardino. Um, with that, there are still people who would be eligible to full scope Medi-Cal regardless of their immigration status. So that would be children's ages 0 to 18, pregnant people for their whole pregnancy and then their postpartum period as well, and then former foster youth under the age of 26 who are in foster care on their 18th birthday. So with the full scope changes, essentially it's telling us that if an individual does not complete their Medi-Cal renewal packet after January 1st of this year, they may no longer be eligible because of their immigration status. And it's really unfortunate because in the healthcare business, we want everybody to have access to care. However, with the new laws that changed effective this year, it's making it a little bit challenging for individuals. On July 1st of this year, we will see that the dental coverage that is provided through Medi-Cal, that dental coverage will end. So unsatisfactory immigration status members or patients, depending on business, age 19 and up will stop getting full scope dental services as part of their Medi-Cal coverage. So in your work that you do with your communities, this is where we really want you guys to stress this information to families, because we don't want them to go to the dental office and then find out that the care that they received after July 1st is no longer covered. As we go into January of 2027, we'll also see that the work requirements will change. So adults ages 19 to 64 will need to work, volunteer, or go to school to keep their coverage, right? And some of you may be thinking, like, individuals at certain ages or depending on what's going on in their household, maybe can't work, may not have the skills or resources to find work in their field. But starting January 1st, that will change where there will be that work requirement. Also, what we'll see in 2027 is the 6-month eligibility check. So this is where adults ages 19 to 64 will have to renew their Medi-Cal eligibility twice a year. So are there any folks in the room who remember the MSR mid-year status report? Have you heard of that term before? I see a few hands. So that was essentially what individuals had to complete every 6 months to keep their Medi-Cal. So it was a single page sheet that would get mailed to the households, and the individuals have to check a box. Remember that? I hear some yeses. So they would check a box if their household stayed the same, or not check a box if nothing had changed. But if the individual reported, yes, I've moved, or yes, I've started a new job, then they'd have to provide new income verifications or verifications of that change. So that will be starting in 2027 as well, right? And then also retro coverage. So Medi-Cal will only pay for 1 month of past bills for adults 19 to 64 without children. So has anybody heard of the term retro benefits? All right, so that's essentially what this is. In the past, individuals were able to request that 3 months worth of billing was paid for, but now, in 2027, that will be reduced to 1 month, right? So it's pretty significant changes that are going to be occurring. All right. And then also in July 1st of 2027 will be monthly premiums. And so this is based on individuals' immigration status. Some members or patients will need to pay a small premium, estimated at $30 to keep their Medi-Cal coverage. And so this is something that's entirely new that Medi-Cal hasn't seen, where individuals will have those monthly premiums. So again, kind of recapping what we just talked about is that the retroactive coverage period will be reduced from 90 days to 30 days. Medi-Cal work requirements will start January 1st of 2027. There will also be changes to federal funding rules that may limit some immigrants, as certain coverage will no longer be fully supported. And then beginning in 2028, co-payments will be imposed. Oh, I'm sorry. You want to take your picture? We're emailing it. All right. So again, some key changes is that effective January 1st, Medi-Cal applicants 19 years and older without satisfactory immigration status will only qualify for restricted benefits. And so restricted benefits essentially means emergency room services only. Right now, individuals can go receive care for preventative care, but as of January 1st, it's restricted benefits means only only emergency room services. I talked a little bit before in the previous slide about the dental benefits. Again, those will no longer be provided to adult members 19 years or older, and then members under 19 years old pregnant will remain eligible to full scope Medi-Cal with dental. And so you may be asking what full scope Medi-Cal with dental with no dental covers. So members will still be eligible to medical care, specialty care, and mental health care, as well as family planning, maternity care, and emergency care, and then their vision, hearing aids, in-home care, and a few more additional services. So I do want to speak a little bit about the Medi-Cal renewal process for those who may not be familiar with it. And then we do have our county partners over here at the back table if you guys have additional specific questions about Medi-Cal renewals. But essentially, every year, a member has to complete a Medi-Cal renewal packet. Depending on the month that they initially applied is when they will have their renewal. So if I applied for Medi-Cal in March, then every March will be when I have to renew, right? So here in Riverside and San Bernardino counties, a Medi-Cal packet will be mailed to that member's home about 60 days before their renewal packet is due. Members have 60 days to fill out the packet and return to the county. Members have 60 days to return it and get it back to the county. It comes in a bright golden envelope to their home. We're the Golden State. So it comes in a bright, golden, recognizable envelope to their home. And so it's really critical that this isn't placed in the back pile of junk mail as it may get lost because it's a long window that members have to get all of their verifications available to turn it back into the county. So members can submit their renewal packet in multiple ways. One of those ways is mailing that completed packet back to the county, or walking it into the county, submitting it via the Dropbox or an eligibility worker. But also online through benefitscal.com. Here at IEHP, the eligibility and outreach team, we do encourage members to create a benefitscal.com account. This is the fastest and easiest way to submit anything to the county, to turn in your verifications, or to connect with their worker. It's very important that the members submit their renewal and turn in all the rest requested verifications, because if they don't, they may lose their Medi-Cal eligibility. They may lose their favorite health plan of IEHP coverage, and they may potentially be reduced to restricted scope Medi-Cal benefits, right? So a part of the work that our team does here at IEHP is that if a member needs additional support with completing their packet, is that we will meet them at a DPSS office so that they can turn their stuff in. We will meet them at a Social Security office. Whatever is that need, we will go to them to ensure that they turn in their paperwork. In the work that you all do, we really want to stress upon, if you're working with members and clients, patients, is that you impress upon them that it's critical to sign the back page of their renewal, because if they don't sign it, it's not complete. If they're working, to turn in any pay stubs for that current month that's being requested, because oftentimes members think that they have done all these things and then they didn't turn in their verifications, and now the county has to request it. So then it becomes a delay. And so we don't want there to be any delays. So if we can communicate to our populations the importance of turning in their verifications timely, and like I said, we have a 60-day window, right? It seems like a long time until it comes the week of. So you guys all know about that, huh? All right. So for some guidance, I'll respond promptly to the renewal package from their prospective counties. If discontinued, members do have a 3-month post period. We call it, oh, Gary, where am I at? Cure period. There is a 3-month cure period that will allow the member to turn in that application without losing the status that they previously had. had a full scope, or some individuals already have restricted scope benefits. However, they will have 3 months to get everything turned in timely. Members can keep track of their renewal by going to benefitscal.com. They will also see any notice that the county has sent to them in benefitscal.com. All right. But like I mentioned before, it's really important that all of the members respond timely to the request from the county. Members can also contact our IEHP eligibility and outreach team for assistance in submitting their renewal packet, and we will also guide them through all of the steps, answer any questions, because it's a lot of pages, right? How many of you have seen the Medi-Cal renewal packet before? It's a lot. It's several forests, right? And we need our forests. So we really want to make sure that members are reading everything in detail, so that they can make sure that they have all the critical information. But it is a lengthy packet. But that's why our team here at Eligibility and Outreach can support members through that process and answering any questions that are on that packet. So I did want to get a little bit into the work requirements that I spoke to earlier. As I mentioned, adults ages 19 to 64 will have to work, look for work, or participate in approved activities that start January 1st of 2027. So I know it's a little small, but I'm gonna summarize this for you. Members will have to do a few of the following things in order for it to be considered work. Is that they will have to earn at least $580 a month from working, right? Be a seasonal worker, which is someone who works during certain times of the year, and make an average of $580 a month over the last 6 months. Be in a job or training program that helps them to learn skills to get a job for at least 80 hours per month. Volunteer or do community service for at least 80 hours a month. These should be organized in something that the member can do, or to get proof, get a letter from said organization that they did participate in these activities. Work is also considered going to school at least half time. This usually means taking at least 2 or 3 classes at their local college, community college, or university, or a trade school even. If they're in cosmetology school or barber school, those are also approved as well. Any of those things that I've mentioned before that are on the screen that total up to 80 hours per month and where they earn at least $580 a month will be a qualifying activity. But they're all, let me go back. Okay. There are also some qualifying exemptions as well to those work requirements that I just mentioned. So anybody that's 0 to 18, they don't have to meet work requirements. Older people, 65 and up, will not have to meet work requirements. Pregnant people, including those who are 1 year postpartum, parents with children ages 0 to 13, people with disabilities, serious health or mental health conditions, people who were released from jail or prison within the last 90 days, or individuals who are on Medicare Part A or Part B, an American Indian or an Alaskan Native, or our former foster youth who are under the age of 26. All right. So, how do you guys feel about this? Is this making you feel a little bit easier about your populations and the work requirements? Yes. Yes. Alrighty. So like I mentioned before about the old MSR, mid-year status reports, so the new term we're using is 6-month eligibility checks. Those will start in January of 2027. Again, those are for individuals ages 19 to 64, but it's important to know that members may need to renew their Medi-Cal every 6 months, depending on what the outcomes are of what they say on their 6-month eligibility check. Yes, if something changed in their home. But who will continue with a 1-year renewal only? Those are individuals who are in a Medi-Cal program that is not under the Affordable Care Act new adult group, pregnant or postpartum individuals, Alaskan, Native, or American Indian, and then again, those former foster youth under the age of 26. So there are some exemptions, as you can see, in every category. I did want to provide to you guys the county contact information for our partners. We have San Bernardino County. Their 877 number is their customer care center, their customer call center. And then the same thing for Riverside County. It's also their call center teams. So if you need any support, if you have any members that have questions about their Medi-Cal, if they want to speak directly to their worker, these are the numbers that they will call for that support at the county level. And it's not just for Medi-Cal. Whatever additional self-sufficiency programs, CalFresh, CalWorks, also Cash Aid, General Relief, or if they need EBT cards, replacement or issued, anything like that. So how can you collectively support our members is sharing the information that I've shared with you today. We do have some flyers on your table that provide an overview of what I've been speaking to as well, but advise members to keep their contact information current. You wouldn't believe how much mail we send out at the county level and an IEHP that we get back because we don't have that member's current contact information. We move, right? And you'll call your cell phone company, you'll call Verizon, you'll call Spectrum to do your address change. But you may not call your health plan or the county. So please, with the members that you're in contact with, make sure that we have their current contact information, address, but also their phone number. With our team, we send out text messages to the members to remind them of their renewals. And as part of our text messaging campaign, we get replies back. And they're like, this is not my phone number. I don't know who this person is, but that's all that we have on file. So if you can really make sure that you're sharing with individuals to update their contact information, also advise them to complete their renewal, right? You don't know that you lost it until you go to use it and don't have it, right? So it's really important to create that benefitscal.com account so that they will always know where they're at with their benefits. All right. Share these flyers with your members within your organization. We can also, my team, we can make some available to you. So if you want to put on your front counter, when you're doing resource tables as well, you can share information about these changes. And then also you can direct members to call us. We are more than happy to take their call to assist them in navigating through the renewal process because it can be very tedious and you could feel defeated when trying to go through it. Like we mentioned before, I am one of 2 managers here in eligibility and outreach where we lead a team of 68 team members. And when I mentioned before that we support our members through renewal, we support them by doing outbound calls. So just about every month we receive about 30,000 households to call between Riverside and San Bernardino County to educate them on the renewal process. This is the 3rd year that our team has helped members go through the renewal cycle. Some of them are familiar. They're like, we know you called me last year, you helped me, it was amazing, right? But sometimes when individuals apply for Medi-Cal, they don't know that they have to renew it every year. They think it's one and done and may forget that just that it's you have to renew every year just through living life, right? But that's what our team here is for, is to continue to educate them on the renewal process, letting members know the documentation that is needed to make that renewal complete for the next year. And then also our team works with doing community-based events and engagement activities. We also work with our community engagement team. We have that team back here in the back. Waving, thank you so much. If you see an IEHP branded booth at any event in the community, it likely is our community engagement team. And they often invite the eligibility and outreach team so that we can be in the field answering questions as it relates to Medi-Cal renewal. Our team, we also are on site here where we have team members on site at least 3 days a week if a member walks in and want support, but we also provide support at our community wellness centers. The one in Riverside, right near the Tyler Mall, and there's also one in Victorville. Right. So this is the information on how to contact the eligibility and outreach team. If you scan that QR code, it will take you to our IEHP eligibility and outreach public-facing website. And on this website, members can put in their name, phone number, email address, and if they need support, we will respond back to that email within, they can do an inquiry. We receive it as an email. Once we will receive their email, we will respond back to them and help them in any ways that they need help. So I do want to transition a little bit to Benefits Cal. Or can I get a raise of hands if anybody can tell me if they know about Benefits Cal? Have you heard of it? Alrighty. So, like I said before, what our team does is we rely on the use of Benefits Cal with our members creating these accounts, right? Not only does it help the member in the long run, it also helps us knowing that the member will always have access to their case information. So community-based organizations can apply and utilize Benefits Cal for their support within their organizations. So any nonprofit organization, a community center, hospitals, advocacy organizations, we really encourage you to apply and manage a CBO account with benefitscal.com because it lets you track the number of individuals who are applying for services at your level. So in the past, you may tell an individual, go to the county of San Bernardino, go apply for benefits. And you kind of send them on their way, but you never really know if they actually applied or if they're running into any barriers. However, with you being a nonprofit organization, if you set up a Benefits Cal account, you can help that individual apply for benefits and then track the progress of that account as the member navigates through that application process. So in Benefits Cal, community-based organization staff can either have a CBO manager account or a CBO assister account. So the CBO manager accounts are usually for leaders or people in charge at the CBO. Have the ability to oversee the work on the staff who are called CBO assisters. Are there any CBO assisters in the room? Yes, all right. Thank you. So you know what I'm talking about. You want to do the presentation for me? Okay. So who uses the CBO assister accounts are usually staff members who work for CBO managers. If you need a CBO assister account, then you can ask your manager to set one up for you. But what can a CBO account do? For both CBO managers and assisters, you can submit applications, upload documents, and generate reports as well. So I do have a brief clip that I want to share with you all about benefitscal.com. This information is pulled directly down from Benefits Cal YouTube website. And so it will give you a little bit more deeper dive of what a CBO can do with the Benefits Cal account. So I will go ahead and click play here. Okay, hold on. We're gonna pause and add our volume. Yes. So I've created a link at the bottom where it says benefitscal.com on the bottom left, and it will take you directly to this video.
Community-based organizations can do several things on behalf of clients within BenefitsCal. They can submit applications, upload documents, Community-based organizations can do several things on behalf of clients within BenefitsCal. They can submit applications, upload documents, check application statuses, view reports of activities, create referral campaigns, and create and manage staff accounts. There are two types of CBO accounts available on BenefitsCal: a CBO manager account and a CBO staff or assister account. Both managers and staff can use BenefitsCal to apply for benefits, upload documents, view reports on customer applications, and view and track referral campaigns. CBO managers can also create staff accounts, view staff applications, view reports for staff application, resume applications on behalf of staff, add and remove staff within their organization, and create referral campaigns. CBO manager accounts are usually for leaders or people in charge at the CBO. They can oversee the work of their staff, who are called CBO assisters. CBO assisters are usually staff members who work for CBO managers. If you need a CBO assister account, ask your CBO manager to make one for you. Now, let's get started with how to request a CBO manager account and log in. First, navigate to benefitscal.com. From the home page, click Login at the top right corner of the screen. This is the login screen. Here, users who already have an account can log in by entering their email and password and clicking the Login button. CBO assisters will need their managers to create an account for them and can't request an account through this process. If you're a CBO manager who does not have an account and would like to request one, click the Create an Account button under the Don't Have an Account section. Next, select the CBO Manager Account option from the menu and click Next to continue. To request access, complete all the required fields. For the county, select the county where you assist the most clients. It's possible that you work in more than one county, and that's okay. Just select one for the form. Check the box to accept the terms and conditions, then click Register to submit your access request. The access request is on its way to the county. The county will review the request for access, and it may take a few days. Once approved, the county will create your account and send an email with instructions to get started. Here's an example of the email you'll receive. The email includes your user ID as well as instructions and a link to complete your account registration process. Click the link to continue. Enter a password for your BenefitsCal account. The password must be at least 8 characters long, have at least one letter, one number, and one special character. It also can't include commonly used words like password or character patterns like QWERTY123. Once you selected your password, re-enter it in the Confirm Password text box and make sure it matches the password you entered above. Then, click Save to finish creating your account. Congratulations, you've successfully created a CBO Manager account. After creating your account, log into BenefitsCal using your user ID and the password that was just created. Then click Log In. Enter 3 security challenge questions to help you recover your password in the future. Select a security question from the drop-down menu, then type the answer in the boxes provided. Then click Save. Finally, click I accept to accept the BenefitsCal terms of use and log into your account. Next, we'll cover a general overview of the CBO dashboard. Here's the BenefitsCal dashboard for CBO and staff. At the top of the screen are menus for various topics. BenefitsCal is also available in many different languages, accessible from the drop-down menu. This is the dashboard for CBO managers. On the left is information about applications. Click the View Staff Applications button to see staff applications and the status of applications you submitted by status. Click the New Application button to start a new application. On the right is access to the Document Center, reports, staff accounts, referral campaigns, and help resources. Now, let's go over how to create and manage staff accounts. From the dashboard, locate the Staff Management card and click on Manage Staff. Here, CBO managers can add new staff member accounts by clicking Add Staff at the top of the screen. Fill out the required boxes with the staff's information. Then click Create a Sister Account to continue. Great, the account is created and BenefitsCal sends an email to the staff's email address to complete their account setup. The Staff Management screen allows CBO managers to view more information about the staff accounts. Click View next to a staff account to bring up the Staff Details screen. Here, CBO managers control if the account is active or inactive and shows more details about the staff account. If the account has a lock next to it, that means it is inactive. Now, let's look at how to view applications submitted by staff at your organization. Starting on the CBO dashboard, click the View Staff Applications button under the Staff Applications section.
Alrighty. So I wanted to give you guys a brief overview into BenefitsCal. Now that you guys have seen this preview, how many of you will be going back to set up a BenefitsCal account? I got one, a few hands, or for show. Anybody else? It is definitely beneficial for you to have a CBO manager account or CBO assister account. The video is 18 minutes long, but we didn't want to play the entire thing, but it does go into a little bit more detail about the different reporting that's also available to you all. But again, I highly recommend this as a resource for you and your organizations so that you can help your population navigate through the process and even see if there's been any delays. Alrighty. So does anybody who uses benefitscal.com have any tips for those of us in the room who will be setting up pages? I heard it's really easy.
You can do like the applications really quick. It's not confusing at all.
All right, and we have our county, San Bernardino, with some feedback.
So not a CBO, but I do have our contact information here from our outreach wing. If you guys are having any technical difficulties along the way getting approved for that CBO account, we can help along the way as well. If you need more information regarding the programs and how it looks like, we can provide presentations for that as well. So I know I shared that information with a few of you, but for those of you who haven't approached the table yet, I know there'll be a moment later on today, we are available.
Thank you very much. Well, that is all the time that I have. I am going to pass it back to Sarah, but I will be available over here at the end, or Justin and Gary at the back table here can also answer any questions that you guys have on Medi-Cal renewal. Thank you so much. Here's Sarah.
Thank you, Andrea. Wow, a lot of information, right? Good stuff. Anyone learn something new today? Okay, excited to take it back to your team? Awesome. Again, just want to thank Andrea for that presentation as we are experiencing technical difficulties. But next part of the program, we do want to share, we do have resource tables in the back. And part of today is not only sharing with you the information.
CBO managers can view the application.
Hold on. All right, we're back. So part of it is we want to share with you the information, but we don't want you leaving empty-handed without resources to support you in that process. And so we have a plethora of resources in the room, both from the IEHP team side of the house, the foundation, as well as the county. So you've heard from a couple of folks here already on the screen, but wanted to bring up some additional folks in the room so that they can share a little bit more about what they have available at their tables. At the end of the program, we do have time carved out for you to go introduce yourself to the folks at the table, learn some more information. So in the room, we do have Medi-Cal eligibility and outreach. We have the mission team who will be coming up here just a second. And we'll also hear from the community engagement team. And I'll be sharing some more resources that the foundation team has as well. And before I turn it over to the mission team, you saw this screen when you first walked in. We are so excited. We had over 140 folks register for today's session. This is just the first of 4. So I want to thank you all for signing up, but these are also great resources for you to tap into, especially those organizations that may already be using Benefits Cal. Definitely lean on them as a resource. Ask them about the process. How do they implement it with their community members? What have they learned? So please, you'll have this slide deck copy emailed to you afterwards, but please lean on each other. And on that note, I'm going to bring up 2 wonderful women from the IEHP mission team to share a little bit more about the renewal retreat. So Jen, Lucia.
Good morning, everybody. How are we? We are great. It's so good to be here with you. My name is Genevieve. There's a Genevieve in the room. I don't know where she's at, but it's so good to meet you. My name is Genevieve Body. I get to be the Mission Integration Manager here at IEHP. The reason why I say I get to be is because our team is a very special team that's not familiar with a lot of organizations, including healthcare organizations. So what we do is we make sure and partner with leaders here at IEHP and their teams that we are integrating mission into our workflow. It's a beautiful thing to live in both spaces at the same time. So in addition, we're extending our services to you, where you are doing the people work. And that means so much to us because you're doing the people work and we want to be able to work with the people who are doing it. When you're in service, we sometimes forget to fill up, right? We're constantly in that space of giving and doing. So today, Lucy, who is also on the mission team, is going to introduce some services that we have for you that are absolutely free, and we're excited to give them to you because you take care of our members, and that means so much to us. So thank you so much for being here.
Well, good morning again. It was such a pleasure to get a chance to meet some of you this morning. My name is Lucy Bess, and I'm a mission coach with Inland Empire Health Plan. I love being here with CBOs. When I started here at IEHP, I was on the outreach team, so I had the opportunity to mingle with y'all through the organization. I even got a chance to see some familiar faces from 13 years ago. Yes, I started here when I was 15. And but really, it's just amazing to see the work that you are all doing. And like Jen was mentioning, this work can be hard in times like now, right? This is a time to help fortify yourself. And that is the work that we do here on the mission team at IEHP. Our mission is to heal and inspire the human spirit. And we believe that that starts here within our walls here at IEHP. And like Jen mentioned, the beautiful thing is we are now expanding that reach to our community-based organizations. So we're really happy to help expand this program to you free of cost. I did want to share a little bit about what that looks like today. But before I do, I just want to share with you some of the organizations that we've worked in the past and what some of them have had to say from this work. So we've done some retreats last year with Michelle's Place Cancer Research Center, Cedar House Life Change Center, Family Assistance Program, Young Visionaries, DAP Health, just to name a few. And one participant shares the following. I didn't know what to expect from this event. My leader just showed me to show up. But the retreat was a gift for us. It helped me pause and reminded me of that I am part of something bigger than myself. I didn't know how much I needed this until we left. So the work that we do in the communities is vital. And when we think about healing and inspiring the human spirit, I'm looking at a room full of healers. And we need healing and inspiration as well. So that is what our hope for you in this program. So what does this look like? So the IEHP Mission Integration Team offers 3 to 6 hour renewal retreats for you and your leadership team. It can be at your location, we can come to you, or you can come here, most likely here in this beautiful building here at IEHP, and we'll provide lunch if you come to us. This is zero cost to you. It's just something that we feel is important for our community-based organization partners to have access to really help fortify you to go out and continue to do this great work. We generally say that up to 20 participants is a good size for these types of experience. So generally anywhere from 12 up to 20, 25 is probably the most ideal experience. And we do this through shared dialogue, experiential learning. I don't want to give away too many details, but it's really just a matter of just showing up and being open to the process. Where our hope for you is that you leave with clear purpose, really connecting back to why you started this work in the community, building authentic trust and connection, human connection with others in the room. And that connection comes back when you go back into the office to do this work. It will continue to show up in the way that you connect with one another. And you gain practical tools, not just to use for yourself, but hopefully turn around and use back with your team, with your participants, the clients and members that you're working with out in the community. So, again, this isn't just work we want to keep within IEHP. We want to continue to share it with you so that you can, in turn, continue to create those ripple effects throughout the IE. There's flyers in the back. There's flyers on your table. The next step, if you're interested in partnering with us, is scanning the QR code either here or on your flyer. And we'll take some information for intake, basically what you're hoping to get out of it, how many people are on your team, when ideally you would like for this to happen. And the next steps after that, someone from our team will contact you to set up a kickoff call, a brainstorm session to really get an understanding of what you're looking for, and we can tailor that experience for you. So we'll be in the back if you have any additional questions. I look forward to connecting with all of you. Thank you.
Thank you, Lucy. Thank you, Jen. And I will take the clicker. Thank you. So please, as you can see, I have a lot of resources to bring to the table. And as our trusted leaders and messengers in the community, we want to make sure that you're taken care of. So we believe not only in investing in your organizations, but also investing in you as leaders. So please take advantage of that opportunity. I'm excited to bring up Daniel and Renee next. IEHP has over 1,000 employees, or 3,000 employees, which means there's 3,000 sets of hands here to help and support you. And so we've had some feedback from our partners asking, what are all the different opportunities to connect with IEHP? So here's another one. Daniel and Renee will share a little bit more about the Community Engagement Ambassadors.
Thank you. So good morning, everyone. As Sarah said, we are the Community Engagement Ambassador team. I recognize a couple of faces over here. So we are pretty much out in the community, engaging at events, getting information, gathering those referrals that our members need in order to connect them back to the plan. So one thing that makes me proud about working here is that I see us as the only plan that's actually out there gathering that information and getting them the resources and the referrals and the information that they need. I mean, you guys have gone to a lot of community events, right? You hand out a flyer, what happens next? We don't know. So the important thing is that we've created a system where we're able to actually take their information, and someone from our teams are going to reach out directly to that member. And I'm going to go ahead and pass it off to Daniel so he can talk a little bit more about the partner networking meetings that we have, and also just how we engage outside of community events. So.
Hi, good morning, everybody. I'm Daniel. I'm one of the community engagement ambassadors for the West End and the High Desert area in San Bernardino. So we host our community engagement, our partnership meetings. We do those monthly, but we do separate them by territory or on a quarterly basis. So, for example, we have the High Desert one coming up in August. Anyone that is interested in participating in those partner network meetings, we send out the information for registration ahead of time so everyone can go ahead and learn a little bit more about our partners and how the engagement looks like in our territory. So the events are hosted either in our Victorville location as well as our Riverside area as well. Once we have San Bernardino up and running, then we're looking to cover that as well. So yeah, you'll see us out in the community. If you have any events that we would like to see IEHP engagement or participation, our information is out in the back. You can reach out to us. We have a little bit of information that we show about all of our services. We can't carry all the marketing material for all of our programs, even though we would like to, but it's a lot of information that we like to share out to the community, as well as, like Renee was explaining, the referral process. We like to meet our members halfway with the services they may require. So if you're interested in that, please reach out to us in the back and we can get you connected with all that information.
I think that's it, but shout out to the CBOs. Thank you guys. You guys make our jobs fun and engaging. So, props to you guys for all the work that you do as well. Thank you.
Thank you, Renee and Daniel. So again, you'll have plenty of opportunity at the end. We've carved in some time to visit each of the tables. And then lastly, I want to share a little bit more about the resources the foundation has to share. You heard a little bit from our CEO and two of our board members about why the foundation exists. So really, we're looking at investing in those upstream measures, realizing that health doesn't just begin or end in the doctor's office, but it starts long before and it continues long after. But that doctor's visit is important. Hence, we want to keep folks connected to healthcare. And so we're really big on investing in the leaders and the organizations, making sure that you have the social capital, but also the financial capital as well to help support your members. And so just to kind of share a little bit more about our partnership with IEHP, we were formed from IEHP through an endowment, but we are a separate organization. So we work hip to hip, hand to hand, hence the event today, to make sure that our community members have access to healthcare, but also have access to those social drivers of health that we know are key in keeping individuals healthy. And so highlighting the foundation funding areas, we are a grant-making organization who focuses on supporting nonprofit leaders and organizations that fall and address some of these categories. And they can be indirect service providers or direct service providers. So if you're a coalition or a collection of organizations, or you help provide capacity building, you also fall into one of these categories, we're happy to support you. And so we're really focused on making sure that our community members live in neighborhoods that help promote healthy living. And so on the building healthy neighborhood side, we do use the vital conditions as a way to organize our social drivers of health, but we invest in organizations that are addressing basic needs. So that's access to mental and physical health, as well as food and nutrition or exercise opportunities. We have a really big push on meaningful work and wealth. So making sure that those organizations that are helping with workforce development opportunities, especially in healthcare and social services, but throughout, we're helping to support those organizations. And then any organization that's addressing humane housing, and that's the whole housing continuum, from supporting those individuals that are unhoused, that may have unstable living, all the way up to home ownership. And then through supporting these healthy neighborhoods, we also support organizations that are helping individuals cultivate that healthy living or healthy behaviors. So increasing those healthy behaviors, those exercise, those walking opportunities, and also decreasing those risky behaviors. So mitigating addiction or any negative behaviors like that. This is just a quick recap of how we help support and build capacity of our trusted health messengers. We realize that we're not the ones doing the direct work. We look to all of our partners here in this room. And so we're just here as a support for our partners. And so some of our big key investment areas, our biggest investment by far is our Champions for Vibrant Health Leadership Network. So it's a group of 40 organizations, 80 leaders that we've made a 2-year commitment to build their leadership development skills and also their policy and advocacy skills, making sure that we have a healthy policy here in the Inland Empire. Last week, we got an opportunity to head up to Sacramento with them. Raise your hand in the room if you're part of this network. We have a few of our champions here. So if you have any questions about that, they'll probably be happy to address that. But also, this is our first cohort. We're really learning alongside them. So come fall, look for that application. We are going to be launching our application for our next 2-year cohort. We also do capacity building grants. So those are smaller cohorts focused on a specific topic of interest. And so we use these vibrant health forums as an opportunity or a litmus test of a specific topic. And if there's interest, we'll create a cohort after that. So if you've come to a previous Vibrant Health Forum before, we have focused on nonprofit capacity building, kind of business 101. We've done storytelling, fundraising, so on and so forth. Which leads me into that third category is playing a role as a convener. So quarterly, at least once, we host Vibrant Health Forums, realizing the importance of the Medi-Cal retention and policy updates. This is our first time that we're bringing the Vibrant Health Forums out to the community. So you'll see the dates and times of our remaining 3 in this series. But if you do have any partners that serve other parts of the region, we are bringing this opportunity out to them. And then we are traditional grant makers, so we do have our traditional or responsive grant making opportunities. We really want to make sure we're listening and responding to the needs of our partners. We also have some place-based work, so I'll just lift up 2. On the Riverside County side of the house, we have partnered with the Blue Zones Project in 5 communities. So if you operate in one of these 5 communities and you're interested in being connected to that work, please reach out. I'll be staying up here after the program if you have any questions. And then on the San Bernardino side of the house, we've invested heavily into Barstow and San Bernardino City proper through our Vibrant Village initiative. And we have Edgar somewhere in the room, or he was outside. But if you do have questions and you want to tap into that work, feel free to reach out and happy to have that conversation. And then probably key for today, these are upcoming events and grant opportunities that we have here open at the foundation currently. So as I shared before, this is the first of a series of 4 events. So we'll be taking it on the road 1 a week for the remaining time in March. So you see the times and dates there. If you have any partners or additional team members that you think would benefit from coming to this training, please share that information with them. We also have open an application for our second round of our Vibrant Health Fundraising Training Program. And so there's no direct funding attached to this, but it is a free program, estimated about $2,500 per individual. It's a 7-session, no-cost training to help nonprofits learn how to cultivate individual and major gifts. We realize that grants and public funding, it can be unstable, and so we want to take that ownership back to the organization and help that organization build those individual donors and major gifts. And I will share that our last cohort, we did our first cohort last year, and through a group of 20 individuals, within just 6 months after the cohort, collectively they saw an increase in over 50 new donors and over $500,000 in net assets for those organizations. So please check out that application. On average, it takes about an hour or two to complete, and those are due March 9th. And then our other grant opportunity that just opened up is our responsive grants. And this is if you think of traditional grant making, these are the types of grants. If you have a project or an initiative you want funded, check out this. We just launched those. Grant Cycle 1 is going to close February, or it's open now. We'll make the announcement in May, but that application's due in about a month. We do have a virtual info session coming up on March 13th. So if you want more information, you can go to our grants website, sign up and hear more about that. The different opportunities range anywhere from 5K to 75K, depending on the type of work or focus of your project. I will say if you're doing Medi-Cal retention work or you're leaning into supporting the opportunity for community members to connect to workforce development or job training or education programs, you're probably going to fall into that healthy communities category. You'll see that Medi-Cal retention is one of our main goals. And so definitely check that out if that's something your organization is doing to see if there's a connection with that. And if you haven't already, subscribe to our newsletter or follow us on social media. Here's the information here. My contact information is here, so if you have any specific questions on grants, I will share out that each of our grants have eligibility criteria, but if there is a unique situation to your organization, we always encourage a conversation. So have a conversation. We can determine if there can be an exception or what the best route would take, but please reach out to us. We really do believe in relationship building. And so you heard from the different folks in the room. They'll all be here for the next 15 minutes or so to answer any questions that you have. So really encourage you to connect with them, learn a little bit more, ask any questions you have for your specific institutions. I also want to lift up here on the screen that we have a post-survey feedback form. And this is critical if you can take a couple minutes just to fill it out. What this helps us, as Greg shared earlier, this is our first event in a series of 4. So if there's anything that we can improve upon that you think would be more helpful for partners to hear about, let us know. This is also our opportunity as a foundation. Based off these responses, will dictate what type of events we plan for the future. So if there's another topic that you're interested in hearing about or a resource that you think your organization and other partners need, please take a few moments, fill out this form. If you have any questions, you can also put them on the form and we're happy to follow up. Yes. Okay. We will email. Anyone else getting that error? Okay. So we will email that. Technology has been foe, not friend today. But on that note, before we end the program, does anyone have any high-level questions that is top of mind that maybe some of your peers may have as well that you want to lift up? Yes. Yeah, so the question, is there potential changes to that 3-month grace period if for Medi-Cal? Yeah, could there be potential changes to that 3-month grace period?
Not unless there is legislation that will change at the federal level. So right now, that is what we'll go off of. That's the guidance that we receive from the state. I imagine that if there's advocacy groups that are pushing for that at the state of California, that may change. But for right now, it's what it is. Yes. It's federal wide. So in California, we call it Medi-Cal, but nationwide, it's called Medicaid. So those are the changes that affect the entire program. Yeah, it's for the entire program. Yes, great question. Yes.
I know that typically within IEHP, there's a desire to connect with the social determinants of health. And so I would encourage that for our members that are housing insecure, that maybe we take additional measures beside just phone and an address, that we also maybe use email and even possibly social media handles. Those are things that don't change, while address and phone numbers do change because of the way in which those are structured. So, particularly at a 6-month increment, like, I am scared for our unhoused neighbors to be able to maintain health. So, I just want to make that suggestion that could maybe happen locally here at a IEHP level, while obviously we advocate on a larger level.
Yeah, absolutely. One thing that our team is doing, like I mentioned before, we do outreach via phone call and text message. We also collect the member's email address, because one thing that we would like to do is email them out the information. Like you said, people move. You may have your email address longer than you have your home address. I've had the same email address since 2005, right? I still use Yahoo. But that's definitely something that we're exploring within our team, is collecting those email addresses so that we can connect that way. Yes, absolutely.
And then I think we have time for 2 more questions.
Thank you. So for the 6-month renewal process, does that apply to the 0 to 18 population as well, or is that only for 19 to 64?
That's a great question. It's 19 to 64.
For under 18-year-old folks?
So typically most individuals that are 0 to 18 are a part of a household. So like with their parent or grandparent or something like that. So that renewal will still automatically be a part of that household within that age range. So when we're asking for the MSR, in most 95% of the cases, it's for the 19 to 65 up case. So adults managing a case.
And one more question. These are all great questions, and if you continue to have them, we have some great resources at the table, and folks will stay behind.
Hi, real quick. This is, I don't know if it's in the slides. If it's in the slides, I'll refer back to it. But as we're talking about when things expire, and I serve a lot of undocumented folks. How do we help them? Like, so I'm just wondering, instead of waiting till later to figure it out. Is there going to be like a list created of like organizations like Healing California, who don't ask for much? So if you don't have something like, because I'm just scared to lose the trust of the community when we go to help them with these things, because I'm still learning how to do all of this. How do we still have the trust instead of just saying like, oh, well, you don't qualify for any of these things, and then bye,
Right.
So.
Well, definitely one thing we want to say is for not to have that potential member determine if they're eligible or not. We want to make sure that we refer them to the county to determine if they will maintain their eligibility. One thing that I didn't necessarily share is that my team of 68, about 99% of them came from the county. So they have the understanding of the eligibility requirements, and they can create that safe place or trust for that member that the information that we're providing is 100% accurate and that it is a safe place. Now, with a lot of the things that have happened within this last year of the things that we've seen in regards to ICE going into communities, we have had that fear for members who don't want to authenticate with us for fear of where their information is going. But we really want to stress that IEHP is a safe place. We don't share members' information with any outside organization, and that they can trust that the information they're getting to us is accurate and that we're not steering them in the wrong way. Our team members, Gary and Justin, and all of our team members of 68 have multiple lists of various organizations that IEHP partners with and other organizations that share this information, that are a resource for shelter, for food, for many different things. I've met you before. We've done a presentation for you, so I remember your face. But we can definitely also send some resources to Sarah so that when she sends out information, we can provide those additional community links to you.
And again, I just want to thank you for coming, spending the time with us. I know you all are very busy individuals. You have a lot of caseloads. You're out there helping the community members. So we don't take it lightly that you're spending your time, your morning here with us. So on that note, please feel free to check out the tables if you haven't already. Again, Andrea and I will be up here if you have any questions. Fill out that form when we send it out to you. And if any other questions pop up, please feel free to reach out. Thank you.